transgender adolescents attempt suicide at rates nearly 9 times higher than their peers. But when they receive gender-affirming care, that risk drops dramatically. A 2022 study in JAMA Network Open followed over 100,000 youth and found that access to puberty blockers was associated with significantly lower odds of suicidal ideation. Research in pediatrics showed that transgender youth who received blockers had lower rates of lifetime suicidal ideation compared to those who wanted them but couldn't access them. And when states ban this care, suicide attempts increase. A 2024 study found that states considering anti-trans healthcare bans saw a 72% increase in suicide attempts among transgender and gender-diverse youth aged 13 to 17. The Trevor Project documented spikes in crisis contacts corresponding directly with legislative debates. This isn't coincidence, it's cause and effect. Gender dysphoria causes documented psychological harm. Forcing transgender youth through unwanted puberty intensifies that distress precisely when they're already at highest risk. But appropriate treatment, whether social support, therapy, blockers, or eventual hormones, improves mental health outcomes markedly. Research shows that transgender youth who felt their pronouns were respected attempted suicide at half the rate of those who didn't. We need more long-term studies, opponents argue. True, we always need more research, but we have decades of data on these medications from treating precocious puberty and growing evidence on mental health outcomes. What we can't ethically do is withhold treatment showing measurable benefit while demanding perfect certainty. Critics claim we're experimenting on children, but we already know what happens when trans youth don't receive care. Documented rates of depression, self-harm, and suicide that far exceed their peers. We're watching it happen in real time in states that ban treatment. Every major medical organization, the American Academy of Pediatrics, the Endocrine Society, the American Medical Association, supports evidence-based, gender-affirming care for appropriate candidates, not because of politics, but because of evidence. When politicians override doctors and ban treatments that reduce suicidal ideation and improve mental health outcomes, they're not protecting children, they're killing them. These aren't abstract statistics. They're real kids whose lives depend on access to evidence-based medical care. The research is clear. Gender-affirming care saves lives, and banning it costs them.